Hello everyone, I am Lance Wilkerson. I'm with electrophysiologist Dr. Chandra Kumbar, one of the top doctors in the Midwest. And today we're going to talk about folks that have anticoagulation problems. As we did about a year and a half ago with the Watchman, they now have a new way to be able to take care of that. And first of all, Dr. Kumbar, can you take us through why this is a procedure that needs to happen?
Sure. AFib, as you know, is a very common electrical rhythm problem. Happens very often as we age past like 65 or so. AFib can increase the risk of stroke. So if you have a patient like who has stroke when they also have atrial fibrillation, the most common cause is a thrombus or a clot. And it typically comes deep inside the heart from a small pouch called left atrial appendage. And the left atrial appendage is almost like a reservoir of blood. But when the heart is not beating right because you're in atrial fibrillation, blood in that segment kind of stagnates and can cause a clot. And that clot that can travel from the heart all the way to the brain and account for 9 out of 10 strokes among patients with atrial fibrillation.
So the left atrial appendage, the Watchman, I know, can cover that up. What are the other ones, and what are the differences between these devices?
Sure. So I think let me take a step back and walk you through the left atrial appendage occlusion device. Right? Mm-hmm. So the Watchman was a left atrial appendage occlusion device. So we were going in trying to seal the opening of the left atrial appendage. So the Watchman is a device where we go in, we expand, let the device expand itself and completely seal off the chamber. Amulet is somewhat similar, but in addition to that, it can actually cover the left atrial appendage ostium with an extra layer of material called the disc. That was actually approved like in 2021, and we were the first site in Evansville and like in state of Indiana to be the first to implant it after it was FDA approved. So we were excited to bring this technology to the local community and be one of the first to actually offer that to our patients. That is a big game changer. So if I have a family member who can't take the blood thinner even for 45 days, I can still gain the benefit of the technology to minimize the risk of stroke, and that is like, you know, a life changer for so many people. And for us to offer that technology in the community ahead of everybody else, you know, it was great in terms of like what we were able to do.
Or how do you determine which is best for your patients?
So if you think about Watchman, it is definitely for those patients who are at high risk of stroke because of atrial fibrillation. And these patients are high risk, but they can still take blood thinner for a short period of time. Amulet is clearly the same group of patients if they cannot take blood thinner at all, even for 45 days. So then we can actually still give them an option to protect themselves with Amulet. It's a catheter-based procedure. You come on the day of the procedure. Procedure takes about an hour and a half to 2, and you're bed rested for a few hours after the procedure. If everything goes well, you're up and walking by the end of the day and hopefully home next day. Patients who actually get the Watchman or Amulet device, at the end of their 6 months when they only have to take aspirin, that changes their life forever. And they are like happy because like now they don't have to make visits to the anticoagulation clinics, and they don't have to worry about like, you know, eating green salads if they want to. So.
It's amazing that it's non-invasive too.
Yes.
The turnaround time is so much. I learn so much from Dr. Kumbar every time I'm around you, so really fortunate, and thanks so much for all that information. If you want to learn more about any of our cardiology at the Heart Hospital or the Deaconess Heart Group, you can go to our webpage at deaconess.com/heart. For Dr. Kumbar, I'm Lance Wilkerson. Thanks for watching and have a great rest of your day.